Hello everyone, this is Dr. Jerome Craig. Today's topic is simple tips for lowering blood pressure naturally. This is for educational purposes only. This is my disclaimer. I am not your physician. Take this information to your doctor. So I am a functional medicine practitioner in Portland, Oregon. I serve my community as an educator, a speaker, and a health advocate. I believe that we need to focus on treating people and not symptoms. And I also believe that using the right tests and the right treatment strategies and educating people about their health is the best way to optimize people's health. There are no such thing as get healthy overnight schemes, so don't fall for that. So, hypertension. Why is this such a big deal? Well, hypertension or increased blood pressure tends to be a big risk factor for cardiovascular disease. In fact, it's probably one of the most dominant risk factors with any sort of cardiovascular incidents. But hypertension in of itself is not a disease, it is a symptom. It is a symptom of something not functioning the way it should in your body. So these are the standard guidelines around blood pressure. Normal is considered anything less than 120/80. And if you're at risk, you're somewhere between 120 and 139 on the systolic blood pressure. And the lower number, the diastolic, you're somewhere between the 80 and 90 mark. Above that, elevated blood pressure. What can we do about this? So one of the first things you can do is expose yourself to sun. Sunshine has been shown to be medicine. Ultraviolet radiation has been shown to produce nitric oxide through mechanisms in the skin exposure to the sun, and that is going to release nitric oxide in the blood, creating increased vasodilation and therefore decreased blood pressure. Vitamin D deficiency has also been associated with hypertension, so if your blood pressure is super high, check on your vitamin D status. We also know that the near-infrared light produced by the sun tends to increase mitochondrial energy. We also know that this can decrease depression, and believe it or not, there's quite a correlation between depression and cardiovascular disease in general. And then we know that sunshine is very, very good for setting the circadian rhythm. This is your sleep-wake cycle. Now, why is this a big deal? Well, there's about 50 to 70 million adults in the United States suffering from insomnia of some kind. Men tend to outweigh women in this, and then above the insomnia numbers, we have about 35% of the population getting too little sleep. Now, the problem is sleep has been shown to have a positive effect on a variety of health conditions, so if we're not getting enough, guess what? Blood pressure also tends to be increased. Sleep apnea is a common sleep disturbance that affects a lot of men. Sleep apnea is associated with elevated blood pressure. So work on your sleep, aim for at least 8 hours in bed each night, and hopefully most of those 8 hours are going to be good, restful sleep. Vitamin K. So here we see some cows enjoying the sun and eating grass the way cows are meant to be fed. Grass-fed dairy happens to be very high in vitamin K2, and also poultry livers and natto, which is a fermented soybean product. Natto also contains nattokinase and vitamin K2 in fairly high amounts. These tend to be very cardioprotective as they tend to lyse clots or break up clots. This is a major risk factor when you have hypertension. These are good supplements to consider if you are suffering from hypertension. While the studies aren't very good at showing that vitamin K directly decreases hypertension, there are some preliminary results that are very encouraging. Nitrates and nitric oxide. So vasodilation, the term we introduced you to a few slides ago, there's a relaxation in the arterial walls, and this will decrease blood pressure. There are a lot of vegetables that are fairly high in nitrates. Beet and beet leaves have been studied quite a bit in this aspect, and beet has been shown to reduce blood pressure. So has celery and celeriac, also known as celery root. Leek, spinach, arugula, there's a variety of vegetables that have these mechanisms. Chocolate or cacao or cocoa has also been shown to enhance nitric oxide in the bloodstream, but for some people with hypertension, we have to be aware of how much caffeine we take in, because there are some correlations in some populations with increased blood pressure with caffeine usage. There's a variety of botanicals that have been studied in decreasing blood pressure. Let's talk about some teas. Hawthorn berries and leaves and roots have long been studied with cardiovascular disease. While the studies aren't very good in just lowering blood pressure, hawthorn may lower overall cardiovascular risk in general. Gotu kola, oolong tea, green tea, all of these have also been shown to have positive effects. Hibiscus has been studied clinically for reducing blood pressure, and you can make a hibiscus and rosehip tea and drink about 3 glasses a day. Very refreshing. That has been shown to decrease hypertension. So look into supplementing with garlic for cardiovascular health if garlic is something you don't like to eat in large amounts. Exercise. Now, exercise is something that's spoken about a lot, and I think a lot of people freak out about it. What exercise really means is just to move more and sit less. You don't necessarily have to do high-intensity interval training or train for a marathon or lift your 1-rep max. Any type of exercise has been shown to benefit cardiovascular health and blood pressure. One of the things we know is definitely not a good idea is sitting for long periods of time, so try and stand for half of your workday. The American Heart Association recommends aiming for 10,000 steps a day. That might be a good place for some, but any sort of exercise, as a reminder, is something we should strive for. Let's talk about minerals. It's not all about the salt. There's this whole idea that salt drives hypertension. Well, that is not the case in most of the population, just in a minority of people. We've got to worry about the balance of sodium to other minerals. A lot of people don't get enough potassium, magnesium, and calcium, and while they might be supplementing with calcium, it's often out of balance with magnesium. Potassium has the greatest effect on blood pressure. We can find it throughout fish like halibut, rockfish, and salmon. Mushrooms are also very good sources of potassium, as are potatoes, sweet potatoes, and regular potatoes, and beet greens once again. Magnesium has been shown to have positive blood pressure effects, but not across the board. It tends to be better when used in conjunction with potassium, so you can supplement these things, but once again, getting a wide variety of whole foods like nuts, seeds, spinach, beet greens may be a good source for magnesium as well. Once again, grass-fed dairy comes up as a good option, especially for calcium, and then we can eat some of the bone-in fish like sardines. They have good calcium levels. Nuts and seeds once again. Stress, a well-known cause of hypertension. Meditation and mindfulness have been studied quite a bit lately, looking at ways to decrease stress. Breath work is another way just to get into this meditation or mindfulness. Just focusing on breath work has been shown to decrease stress levels and blood pressure. You also have to change the way you think about stress. Not all stress is bad. The adaptation to stress can be a positive thing. So change the way you think about stress. And then beware of media in general. There's nothing but bad news out there. Watching the 10 o'clock news is a way to increase stress, decrease quality of sleep, and so forth and so on. Omega-3 fatty acids, they've been studied quite extensively in cardiovascular health. There's some mixed reviews about that, but it turns out that just supplementing with omega-3s like EPA and DHA may not be as good as eating the fish itself. So if you can aim for about 12 to 16 ounces of cold water fish a week, you'll get plenty of omega-3 fatty acids. You also get a wide variety of minerals like selenium, zinc, iron, and well-absorbable protein. Just as a note, there has been an inverse relationship with cardiovascular disease and fish consumption. This is probably the biggest and probably one of the most overlooked. You've got to avoid high sugar foods and refined carbs. There's a very, very strong link between elevated blood pressure and high blood sugars or insulin resistance. We also know that when insulin rises, we tend to decrease the amount of sodium that we excrete, leading to a sodium-potassium imbalance, which can be associated with hypertension. There's also something known as advanced glycation end products, which tend to make your blood vessels less flexible and be a major contributor to atherosclerosis, which is not something you want if you have high blood pressure and can actually increase your blood pressure. Interesting to note, if you are diabetic, most patients with diabetes will develop hypertension at some point. That number looks like somewhere between 50 and 80% of all those who are diabetic. But it tends to be more with those who have blood sugar dysregulation. So please pay attention. Stay away from any sort of sugar bomb. Here's your summary. Please take some notes. And remember, hypertension is not a disease. So sun exposure is very, very important. There's plenty of studies to show that exposing yourself to sun for 20 to 30 minutes a day can increase nitric oxide production and increase vasodilation, therefore decreasing blood pressure. Stress reduction is paramount. If you cannot figure out a way to reduce your stress, please figure out a way to change the way you think about stress. Sleep and exercise will both help you deal with stress better. Aim for about 8 hours of sleep a night. Exercise is very, very important. Just get out and move. 30 minutes a day should be plenty, but you can also do things like break it up several times throughout the day. 5-minute bursts, especially before meals, will enhance insulin sensitivity and keep your blood sugars within balance. Mineral balance is important. Remember, it's not just about sodium, it's about how potassium, magnesium, calcium, and all the electrolytes are balanced. And then healthy fats. If you aren't somebody who likes to eat fish, consider supplementing with essential fatty acids. Decrease your glucose load. Please, please, please avoid added sugars wherever possible. The American Health Association has fairly high recommendations around this, which is for men, less than 9 added teaspoons of sugar a day, women less than 7. The World Health Organization recommends no more than 2 added teaspoons of sugar per day. So aim low and you'll stay within the range. Eat a rainbow of vegetables. Remember, the beets have very, very positive effects, but there are a lot of other colors and nutrients associated with those colors in your vegetables that can be shown to have positive effects on nitric oxide. And then botanicals and teas. Please feel free to search my website. You'll be able to find a tea recipe for hibiscus tea. And then supplement when needed, whether it's essential fatty acids, vitamin K, nattokinase. Thank you very much. This is Dr. Jerome Craig from drjeromecraig.com. If you found this video informative, please share it with others.